So your doctor may have mentioned an induction, said that it might be needed or it might be something that you can think about, and then they left the room, leaving you to casually spiral into a Google web storm, right? You're wondering what an induction's like and why they didn't talk about it more. Today, I want to talk about what your doctor isn't telling you about an induction. And I want to let you know it's not because they're hiding anything. The reality is your provider has like 11 minutes in that room with you, and they've got a waiting room full of other pregnant people who want to know more about their pregnancies. So it simply is that they just don't have time. But you really need to know these things before you go into an induction, and I am here to give them to you. In case we haven't met yet, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I've seen hundreds, if not thousands, of inductions, both planned ones, scheduled ones, elective ones, emergency ones. I've seen all types of inductions, but what I've also seen is lots of patients coming in not informed at all about what is going to happen, which is why I'm so glad that you're here to learn with me about what to expect at an induction. This video is for you.
Attention, attention, paging the pregnancy nurse. She is a nurse, but not your nurse. Thank you.
The first thing that your provider is not going to tell you about inductions is that they can be really long. And that's okay. It's totally normal. And a lot of people think that as they're heading into maybe even the second day of their induction, that something's gone terribly wrong. And they start to think that maybe they want to have a C-section. The reality is inductions can take quite a long time. Now, I have a whole video on if your body is ready to be induced, and I'm going to link that one up above and down below for you. But you gotta have an idea about how long your induction is. Now, we do not have a crystal ball, but we do have educated guesses based off of what your cervix is and your history. Have you had other babies? Things like that. So you can always ask your provider, do you have a guess as to how long this is going to take? And they do have a guess. I promise they do, because they are mentally trying to deliver your baby like after office hours, or at least not in the middle of the night. So they have a guess. Is it always right? No, but it will at least give you some information to start off with. Just know that inductions can be really long, and that's something you got to know going in for. The second thing is that there are different ways that we can induce you, and the other thing is you don't really get to choose which way we do. There's a Foley bulb, there's different cervical ripening medications, there's Pitocin, and we choose all of those based off of what your cervix is, what's up with the baby, your past history of prior pregnancies, and we pick which one we think is right for you. And it's pretty much up to your provider and your labor nurse, because sometimes we get a little vote in the game as well. But it is what it is. It's like a prescription. When you go in and your doctor prescribes antibiotics, usually you don't really have a choice. Same goes for an induction. Now, if you're like, Hillary, what are all of these different things? If you want to go a little bit deeper into how an induction works, I can do that with you in the online prenatal class for couples. In fact, it starts at just $89. You can find it. I'll put the link down below, but it has a full chapter on induction, what to expect, the different kind of methods, and what they're going to feel like. It can be really helpful if you want more information on inductions. And the fun part is you can do it tonight from your couch, and it only takes about 3 hours to even do the full class. If you just want the induction chapter, it's like 20 minutes. Number 3 is that a lot of people, especially on the internet, think that inductions are more painful. Now, I really think that this varies. I actually have a whole video on my own induction that I'm going to link to down below. But the reality is, if you split it, it seems half and half. Some people think that they're more painful, and some people do not think that they're more painful. But you'll hear a lot of people say how traumatizing an induction is, how much more painful it is. And I'm here to tell you that it is more painful because you are stuck in the hospital, versus if you have early labor at home, you can make brownies and eat them and sit in front of your TV watching Traders or whatever you want to watch, Grey's Anatomy, really get ready for the hospital. An induction is really boring, and that really adds to the pain point of it. But you got to get prepared for the pain, because pain is part of any type of labor. I recommend that everybody have some natural pain management techniques, but also understand the epidural. And I would especially recommend that for anyone that's having an induction. It's super important to know your different options. By the way, those are not the only two. There's other options as well, so that you can make the best choice for you when you're actually in labor at the hospital. And I have a whole video on if inductions are more painful. I'll link it down below for you. Now, the next one that your provider is not going to tell you is that you can ask questions. Now, this should be a given in the office. They may say, do you have any questions? And then stand up to leave. I know a lot of providers do that, but you can ask questions and you can push back. Let's make sure that we're being nice when we're doing it. Nobody needs an induction Karen. You're definitely going to want to know why they're recommending the induction. You can also say, this really wasn't part of my plans. I really do not want to be induced. You can also have that discussion about how ready your cervix is. Hopefully they've checked your cervix and they have an idea of that. But bringing all of those into the conversation is so important. And your provider is required to give you an informed consent about an induction. That includes the risks, the benefits, and the alternatives. Now, the one thing that it does not include is walking you through the entire process. Again, they've only got a few minutes to see you at that appointment. So you're going to want to ask the parts that are really important to you. And that's going to vary for everyone. For some people, it's going to be, do I have to have an IV with an induction? For others, it's going to be, am I going to be stuck in the bed with the induction? Talk about what's important to you. This is why a birth plan can be really helpful. Learning to advocate for yourself is so important. In fact, I have a whole induction questionnaire that I recommend everyone take to their provider if they are considering an induction. Even if you already have an induction on the books, I think you should be able to call the office and have these questions answered by your provider. An induction is a change from the normal plan of care of pregnancy, and they should be advising you, and you should make the choice based on you and your circumstances. Remember, an induction is always your choice. It is not your provider's choice. I hear far too many people say, I was forced to have an induction, and I do not want that to be you. That is not the case. I promise you that your provider is not going to show up at your house and carry you into the hospital. I've never seen it, never heard of it, because it is always your choice. It just doesn't always seem that way. But if you remember it's your choice, that's a big win. The next one is what your partner should be doing during an induction. As I've said before, an induction can be really boring, and it can be extra boring for a partner because they're kind of stuck there and you're not particularly in a lot of pain, but you are in some pain and they're just not really sure how to help. But I know that you want a partner that can really support you during your labor. I'm here to tell you that this does not come naturally to most people. Most people do not enjoy seeing someone they love in pain. But once they have tools and techniques that they can use to help support you in labor, especially during an induction, things can be so much better. And you're going to end up with a teammate rather than just a cheerleader who's over in the corner watching the TikToks. I have a class that really helps support couples and gives partners things that they can be doing, including helping you with movement. I'm going to link it down below. And finally, what happens if the induction doesn't work? It's something that they really skip over, but it is a reality that some people's induction does not work. Now, I actually have a whole video on what happens if your induction doesn't work. I'm going to link it up above and down below. But the cliff notes are either you have a C-section if you really need to be induced and baby needs to come out. You can just try harder, try longer and see if baby tolerates it, or you can sometimes end up going home. So I think having that discussion in advance, I got to tell you, so few people take the bright spot of possibly going home, seeing if your cervix is going to do anything naturally. I can't tell you how many patients I've sent home and then a day later they come in themselves in labor because their cervix just needed a little time. I get that. Sometimes I need a little time to adjust to things as well. But I would totally recommend that video down below just so you know what could happen if it doesn't work, because it sometimes doesn't work, just like everything in life. What I want you to take away from this video is that an induction is not a failure. If you watch the video that I'm going to link to down below, I cried and cried before my own induction, and it was completely useless. My induction ended up being really quick. I could have made it quicker, which you'll find in that video. But it ended up being great. The birth was just as magical as all of my other deliveries that happened naturally or without an induction. The ones who really win at an induction are the people who walk into an induction prepared. And I'm not talking about just the induction, prepared for like even the admission process. Sometimes that lady at the front desk can be really off-putting and make you nervous. So really getting prepared for all of it. Again, I will link the class that I recommend that will prepare you for all of those different things down below. Now, here are a few things your doctor is not going to tell you, but I'm here to tell you that the internet is full of crazy things about inductions. I have a whole video on the lies of inductions that you may have heard. I'm going to link it up above and down below. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.